new report is shedding light on what went wrong in Ontario's long-term care homes when the pandemic hit in March. The province's Patient Ombudsman has spent the last few months investigating the crisis. She's not done that investigation, but Kathy Fuchs says she received so many disturbing complaints from inside those homes, she wanted to do something now. She's making 4 recommendations that revolve around contingency planning, visitation changes, improved communication, and enhanced whistleblower protections. Now, for reaction, we reached Betty Yakomenko, whose mother is currently in one of those facilities. Thank you for joining us on the program today.
Thank you very much for inviting me.
Well, I want to start by talking a bit about the situation that your mother and your family has been going through. A 4th outbreak this week at the Madonna Care Community Home in Orleans, where your mother is. She's been tested so many times now. This is the 8th or 9th test, I believe, that she's had for COVID-19 so far?
Yeah, we're going into the 9th time.
My goodness. And so just tell me, how is she doing, first of all?
Well, she seems to be okay. We actually had a Skype visit with her yesterday, so that was good. She just kept falling asleep, but that's okay. But she seems to be doing okay at this point in time. We're just waiting for the results of this last test to come through. It'll be in another day or so, and she'll cleared. She'll be tested as negative, so that will be a good thing. But it's a bit daunting, because you wonder what's going to happen. And as I can't get in there at this point in time to see for myself, I just have to go by phone calls to see what's going on.
Just so folks at home know what's going on, 150 residents and workers have tested positive since April. 47 patients and 2 workers have died. I wonder, when is the last time you were able to get in and see your mother?
Well, we saw her in the summertime for outdoor visits. We were able to take my father in to go and see, but again, only as an outdoor visit. We were not able to get inside. So it's been a month and a half, 2 months now since we've last seen her.
So when you hear...
in person.
I definitely want to talk more in a moment about the present situation and how you're feeling right now, but I wonder, with this report out today, I guess, how do you feel seeing all these stories compiled in one place in particular, or the bigger picture that we're getting from the Ombudsman?
Well, it just adds to everything. The stories are terrible. They're horrible. Family members and residents, for that matter, should not be having to go through this. It's terrible. And versus the report, they've come out with, all the things that we've been looking at in terms of staffing, visitation, communication. Staffing and communication for me are 2 huge ones. And then, you have IPAC or control and the visitation. But it's another report. So we have report upon report upon report that have been done for, even prior to the pandemic. Like, nothing seems to be getting done. If something needs to be done, you can do reports and wallpaper your office with them, but if it doesn't get done, it doesn't mean anything.
In your family's experience, are you seeing any evidence of lessons learned from the first wave?
So there have been some improvements at Madonna in terms of infection control, in visitors, cleaning staff, and staff for that matter. They have improved some of that, some of those items, and that's a good thing. But moving forward into this quote unquote second wave that we seem to be heading into, and as numbers are increasing, my concern and a lot of other people's concerns, I'm sure, with regards to staffing is, if staff start to get sick, hospitals are not, we've been told hospitals will not be able to step in. They're already stretched to the max as it is. So then what happens with backup staff? Is there backup staff to come and help? Like, who's going to, if staff start to get sick, who's going to come in and help? And that's, it's a huge issue. Otherwise, we end up in the same disaster that we had in the spring.
Do one of the recommendations, you touched on them and you seem to agree with, for instance, better communication, but as stricter visitor guidelines, how do you feel about that as an option going forward?
Well, we do need strict visitor guidelines. There's no 2 ways about that. But in terms of essential caregivers, if they give us the protocols to follow, donning and doffing PPE gear, wearing it properly, wearing the parts that are needed to be worn at any particular given. If they give us those protocols to follow, we as family members, be it one person or two people, they say two people, but I think the homes are going by. Be some confusion there. We're more than happy to follow the protocols. We just need to be aware of them. And, we've already been taught and given videos of the various different things for PPE gear. And we as family members, even before the pandemic, we were providing care. We were going in to help feed, and we were going in to provide, the basic personal care to our loved ones. Well, those of us that were doing that, and so again goes back to staffing. Yep. So yeah, it's staffing to me just plays a huge issue, and communication is right there with it.
What do you think it's going to take to make that change in particular happen at this point? I mean, you made the point earlier about enough reports to wallpaper a room. What's it going to take to see these changes, do you think? Well,
first off, the PSWs in particular, they need to be paid a living wage. I'll call it a living wage. Benefits, permanent status versus temporary status, where they don't get benefits, they don't have a retirement plan. They're, majority of staff were working like 2 and 3 homes.
Yeah, the Premier did just announce that pay bump recently. Do you feel like that helps?
Yeah, but it's only, it probably helps for the moment, but that's only temporary. I think it only goes to January, if I'm not mistaken. And that's less than what they were getting during the pandemic itself, like during the first wave. During the first wave, they were getting $4 an hour. Now they're only getting $3. So it's not, they need Quebec did it, BC did it. Quebec has hired 10,000 people. They need to provide a better, I don't know what the terminology is, a better way for the PSWs to be able to enjoy their work. And PSWs need to be able, and I'll repeat that and just say, PSWs need to be able to enjoy their work in terms of having a conversation with the resident. The conversation can't be duty driven, put your arm here, put your leg here, we have to do this, we have to do that. They need to be able to go in and have a conversation with the resident and not be worried the next step down the road, the next resident. When you're working, one PSW per 12 to 13 residents, that's just ridiculous.
Yeah. Well, we're going to have to leave the conversation here today, but I do want to say, Betty Akimenko, we wish you and your family all the best, and I do hope you get the news that you're looking for from that COVID test for your mother.
Thank you very much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.